Okay. Okay, I put them over here, but I'll move it to you. And let's see if anybody walks in, because I'm gonna be kind of like right here, so they can see me. Does that make sense? Okay. Okay, welcome. This is Opponents of Telehealth. I'm gonna start here, but I'll move here and I'm gonna teach to the class. So those of you who are watching the Zoom recording, that's how this is gonna work. Okay, I'm gonna share the screen first. Okay, not sure what that was. Oh no. Okay, I can't share the screen. Never mind. Okay, here we go.
Side effects some would consider a bonus.
I can show you the screen. How about this?
Adult lost up to 14 pounds.
That's why on social media, Ozempic goes by another name, the skinny pen.
Baby, the hype.
Is, I've got a completely brand new body, no fat at all.
People swapping stories of shedding pounds with help from Ozempic and similar medications with the same active ingredient, semaglutide. Doctors say the hype has increased demand for Ozempic prescriptions, making it hard for some to get the medicine they need to treat their diabetes, like Eva Sultana.
It took almost more than 2 months for me to be able to find my dose.
So how are people getting Ozempic prescriptions for weight loss? We start with a simple internet search. NBC News found more than a dozen telehealth websites advertising Ozempic for weight loss. This is one of the sites we found, and it says right here, I can request an Ozempic online prescription. Same day prescriptions are available.
It's a good way.
Let's see how it works. I
I
fill out a questionnaire with my height and weight. It's also asking me what medication is desired. I'm going to write Ozempic. I pay $69 for a consultation fee and submit my request. Within a few moments, the website forwarded my request to a family nurse practitioner. We exchanged a few messages and I had my Ozempic prescription by the very next day. No one ever saw me or spoke to me. It was even easier for my producer, Jamie, who tried another website. She paid $75, filled out a questionnaire, and spent 2 minutes on the phone with the doctor.
This is Jamie.
No one ever saw her on video or in person. That's all it took to get a prescription in less than an hour. And neither of us has diabetes or would be medically defined as obese.
People need to take the fact that this is a medication and it should be taken very seriously.
Dr. Priya Jasangani is a professor with NYU Langone and certified with the American Board of Obesity Medicine. She was alarmed at how easily we obtained Ozempic prescriptions. Is it appropriate for someone like me who's at a healthy weight to be prescribed Ozempic when there are actually people with type 2 diabetes who need this drug and can't find it?
No, Vicky, it's not appropriate. Ozempic is a type 2 diabetes medication and it should be prescribed to individuals with type 2 diabetes.
She says she regularly treats patients who suffered complications after they were prescribed Ozempic from telehealth providers without any guidance.
They haven't had appropriate counseling, whether that's on the adverse reactions you can have with the medication, whether that's side effects such as nausea and constipation with the medication, or even dosing of the medication.
She says if you do need help fighting obesity, talk to your doctor about weight loss drugs such as Wegovy instead of Ozempic.
Both of them are semaglutide. The difference is really the dosing device.
The Ozempic and Wegovy manufacturer Novo Nordisk wrote in a statement, "We are aware there is a growing trend of weight management telehealth providers, some of whom are advertising Ozempic off-label. Novo Nordisk does not directly supply these products to any telehealth providers, and we cannot prevent physicians who treat patients via telehealth from prescribing medications that are then filled by pharmacies. Novo Nordisk does not support or promote the use of our medicines outside of the FDA-approved indication, whether by telehealth providers or otherwise." Novo Nordisk says they have invested $1.6 billion to expand capacity and address the Ozempic shortage.
Okay, so, and I'm just gonna, those of you who are in the class, you're just gonna watch me from here. The recorded class is gonna be like this. You're gonna see the side of my head. Okay, so this is crazy. You can get a prescription for a diabetes medication pretty easily, $69 through a fraudulent telehealth service. Okay, that's unheard of. So what is it about Ozempic specifically? Just don't know if you know this, but this is called the skinny pen for a reason. Semaglutide is the ingredient in Ozempic, and what it does is it kind of tells your brain you're not hungry. So you know how sometimes you're starving and you feel a need to eat, or you wait too long and you just can't stop eating, because that's what I do at night. Don't feel like eating, so you lose weight. The average person loses 14 pounds on the medication. So what's the problem? Well, it's all over social media. You saw kind of the posts, right? It's the miracle weight loss drug. We live in the #1 obese nation, ladies. People want Ozempic. They will do anything to get it. So would a regular doctor prescribe someone of normal weight Ozempic? No. You have to meet the criteria. You have to be clinically obese with a body mass index of 30%, 30. You have to have hypertension, high blood pressure, or diabetes to qualify for that drug, which means they're fraudulently offering it, doesn't it? They're giving you a prescription for the medication. Here's what they don't tell you. Yeah, they'll give you the prescription and they'll take your $79. That prescription will cost the average person $900 a month. Can the average person afford that? If the pharmacy will fill it, right? Which, by the way, now they're not. Now they're triggered by it. Okay, that's concerning to me. And we talked about why this is happening. And if you go to your lead, I talked about the waivers that were special during the pandemic. So none of this happened, ladies, prior to the pandemic. And we know because we did proponents that telehealth was around, right? Is everybody doing both sides today? No. So telehealth has been around since 2015, probably earlier than that. But medical professionals use it to basically connect with their patients, follow up with their patients, explain something to patients, or monitor their patients. This opened up Pandora's box, in my opinion, and it allowed the criminal element in, because the Center for Medicare and Medicaid Services allowed for waivers to be issued during the pandemic, which allowed physicians to legally provide medical care virtually in ways they were never able to do before. It was intended as an emergency authorization during the pandemic to stop the spread, the contagion, right? And it did work for that. But the casualty is there's less stringent telemedicine monitoring, and unfortunately, scammers have seized this opportunity. And it's not just Ozempic. Ozempic is not an addictive drug. Ozempic, the only side effects are vomiting, nausea, vomiting, and diarrhea. Okay, so the problem with even Ozempic, which is not an addictive drug, is what if they give you the wrong dosage? Right? Some people do have a side effect to it. I don't know if you know this, it can cause pancreatitis. Very, very painful, and yes, you can die. So there's no follow-up. They give you a prescription and they never see you again. They never connect with you again. It is about making money. Are we all clear what this is? Okay, so that's a little worrisome, yes? What if you throw in something that is addictive? Right? What do you know about Adderall? What do you know about Xanax? Okay, ADD and ADHD is a neurological deficit. It is a learning difference. If you're ADD or ADHD, you'll see kids fidget a lot, right? They can't focus. They're going a mile a minute. You can't control it. The amazing thing about ADD and ADHD, this is how you know if you really have it. If you give them a stimulant like Adderall or Ritalin, they can be calm and they can focus. So Adderall is called the study drug. If you and I take it, who don't have ADD or ADHD, we can study all night long and ace that test. So kids in high school and college that are under pressure, they like Adderall. If they have a big test coming up, or if they need to do a big project, it will work. The problem with Adderall is it's a controlled substance. It is a stimulant. It's addictive. You take it too often, or you give someone easy access to it on a telehealth, you have created an addiction in them. Okay, so what if you can't get Adderall or Ritalin anymore? You can't get a prescription anymore. Do you know what the street drug is for a stimulant? It's methamphetamine. Okay, we have an opioid crisis. We're the only nation with an opioid crisis. We're so lucky, obesity, right? Opioid crisis, something's going off in America. I'm telling you. Same thing. They're offering opioids to anybody who wants them. No follow-up. Don't know what you're going to do with it, right? For a $79 fee, and you are perpetuating an addiction for someone. You are harming them. You are giving them exactly what they shouldn't have, right? Does anybody know what the street drug is for opium? If you can't get a prescription? H. Heroin. So that's what happens. You get someone addicted to these drugs and they can't get the doctor's prescription. They'll go find the street form of it, which is dangerous because now they're mixing fentanyl in all these street drugs, right? So that's concerning to me. How about you? And here's the worst thing about, there's two companies that are in your packet, Cerebral and Dunn. I apologize, ladies. By the time I get to the last class of the month, I have the entire packet memorized. I know everything in that packet. Does that make sense? Like I can do it from memory. I can show you where it's at in the packet even. Cerebral and Dunn are the two most guilty of advertising on social media, like falsely advertising on social media and really promoting their drug. If you don't have ADD, or you could be ADD, or by the way, Adderall and Ritalin, which are stimulants, also make you skinny. So that's something they promoted. That is so unethical, ladies, because what a physician is intended to do, they take an oath, the Hippocratic Oath, to do no harm. This is doing harm. This is wrong, but there's a loophole because of the pandemic. So what's the problem? Is the internet regulated? No. So they have to, the FDA, the CDC, the Department of Justice, they have to have cause. They have to have proof. So they have to wait until they do enough damage before they can come in and shut it down. So they did come in and shut Cerebral down. But it's just sad. So our public health emergency ends. Oh, okay, I'm not going to use that one. May 11th, 2023. Did y'all know that? The COVID public health emergency ends. What does that mean? Does that mean COVID's gone? No. It just means it's no longer an emergency, right? Are people still dying every day? Yes. But not enough for it to be an emergency anymore. So the problem with that too is these waivers extend. Are you ready? Till December 2024. And they do a lot of damage in the next 18 months. Right. If you go to page 5, this is where it says the Fed charges. That is so weird. It's still foggy, isn't it? It's a brand new laptop. My laptop crashed on Monday.
All the MacBook laptops are foggy. I have a MacBook too.
No, mine wasn't foggy like that.
Oh, yeah, I have a MacBook is also foggy. I don't know.
That's real. I'm going to look into that because I just bought that Monday. My other one wasn't foggy. Interesting. Thank you for sharing that. Okay, the Department of Justice on Friday announced criminal charges against 42 doctors and nurses and nearly 100 other medical professionals for alleged healthcare fraud that cost $1.4 billion in losses. The charges target approximately $1.1 billion in fraud committed using telehealth services. Okay. The charges, 29 million in COVID healthcare fraud, 133 million connected to substance abuse treatment facilities or sober homes, and $160 million connected to other healthcare fraud and illegal opioid distribution schemes across the country. That saddens me, ladies. You have people in pain, people addicted to substances, homeless, people who are vulnerable, and you're taking advantage of them to make money. So, you know, the business of medicine and healthcare has always been people, right? Of course, doctors make money, right? But, you know, they take an oath to do no harm. It is about providing healthcare services. This is so sketchy and wrong. My sister-in-law is a physician, And she's like, I've never seen anything like this. She says, it's unheard of. You are not able, she says, as a physician, to prescribe medications unless you have seen a patient, diagnosed them, right? And make sure that you follow up with that medication. That is standard procedure. That's not being done with telehealth care. So this is not giving telehealth a good name, is it? I love this fraud story, and I'm going to go ahead and do the one on your outline and kind of show you. Go to paragraph 2. So on your outline, you'll notice I'm in without clear guidelines and monitoring of telemedicine claims, fraudulent business practices escalated during the pandemic. So the first one I did is the one I just did with the Department of Justice. This is my favorite story. Court documents showed how telemedicine executives paid doctors and nurse practitioners to order unnecessary durable medical equipment, genetic and other diagnostic testing, pain meds, either without any patient interaction or with a brief telephonic conversation with patients they'd never met or seen. And that's really what you saw with the Ozempic ad from the Today Show. Those orders were later purchased by other companies in exchange for illegal kickbacks, totaling over $1.1 billion in false and fraudulent claims to Medicare and other government insurers. These executives then spend their profits on luxuries such as yachts, vehicles, and houses. How does that make you feel? Right? Okay, so you'll notice on the outline, ladies, this is just kind of a general overview of the fraud during the pandemic that was caught by the Department of Justice. The second one is cerebral and this ADD and ADHD. Why? Because these are controlled substances. These are addictive drugs that anyone can have access to through telehealth services. And the third one is Ozempic. When you do your paragraph, this is obviously going to be the easier one to choose if you're only doing one. You should mention all three. Like I had somebody just do Ozempic, and I said, just doing Ozempic is not enough. Yeah, Ozempic is now, we have a shortage and diabetes patients can't get it. And that's a concern, but even more a concern is this fraud and what it's doing. So first of all, with addictive controlled substances and to our economy, to our healthcare system. Does that make sense? So I don't know about you, these disturbing fraudulent practices really show a dark side of telemedicine and its corruptibility. Agreed. So of the two, this is the strongest argument, which is why I started it with it. Okay, so last week, or the side when we did proponents, we talked about accessibility, right? That more people have access to it. That, you know, if you have a common ailment or if you have an infectious disease, this is great, right? You're not bringing it into the office. But let's be clear. Is it in any way better than an in-person visit? No. Something's going to get missed. Agreed? The person on the telehealth visit, the patient, may not be able to articulate well their symptoms, may forget something. And if the doctor does not see them in person and doesn't look in there, you know, the whites of your eyes show something. I don't know if you know this, under your nails or your toenails, the pigment can show something. They can look in your eyes, nose, and ears, right, in your mouth. And they can detect things that they can't do through a telehealth site. Does that make sense? So a physical examination is pretty important. Can we all agree? Do you get a physical examination through telehealth? I mean, I guess the best you can, right? Telemedicine is through a technology screen. So the relationship is superficial. This is why I don't look at online classes, right? There's something that's missing, maybe an intention or body language. I don't know, something gets missed. A diagnosis through telemedicine then could be inaccurate, correct? And if it's a misdiagnosis, couldn't that be cataclysmic? You miss a heart diagnosis, you miss a stroke diagnosis, that can be life or death. Now, usually what they say is telemedicine is not intended for serious conditions. If you have any thought about heart or stroke, you go to the emergency room. Obviously, if you have a break, you go to the emergency room, right? I have a rash from my Apple Watch. Can y'all see it? That would be something. It's a little pink rash. Can y'all see it? A little bit that you could do in a telemedicine visit. That's not worth my time to go to the doctor's office, is it? It's a fungus. You have to just put an antifungal on it. Telemedicine visits work only for common medical conditions. So obviously telemedicine will allow you to fill prescriptions. Okay, but it was meant to refill prescriptions. That was telehealth's intention. You come see the doctor, you get your diagnosis, they prescribe a medication, and they take your weight in the office, because remember we talked about weight. Weight is not about, are you on the growth chart? Weight is how they give you the right milligrams and dosage of your medications. Someone on a telehealth might fudge their weight, especially if they're ashamed of their weight. And then you get calibrated a milligram dosage of a medication that may not be enough or too much, right? So that was what telemedicine was for. So you didn't have to come back to the office for your refill. Let's just do a telehealth visit and I can give you a refill. How's it going? Any side effects, right? So if you notice that they talked about that on the Ozempic, they're just prescribing these people meds. They're not following up with them. They've never had an initial diagnosis. So this goes against every standard medical procedure, right? Why do you think telehealth providers are doing it on the internet then? What's this about? So cynical for someone so young, right? So some patients require one-on-one. Let's talk elderly. We talked about like elderly proponents. We talked about giving them easier access. Okay, but what if you have an elderly person who can't articulate or has memory loss? That person is going to need an in-person visit. You have disabled people. You have people that may have a hearing or visual impairment. You may have a special needs person. And they're going to need an in-person office visit because they're not going to be able to communicate the way they should through that device, through telephonic. Does that make sense? So this argument is at an in-person visit to the doctor's office. I have no idea about time because I don't have that much time. Can reveal pertinent information that could be missed in an online virtual telemedicine visit. Okay, so opponents of telemedicine argue there are significant limitations to virtual healthcare, which can never replace face-to-face office visits, and they never will. They're not intended to. They're intended to complement, and without monitoring can lead to incomplete or worse fraudulent healthcare. And that's the biggest argument here is the fraud. It is unbelievable. Can I tell you something though? I got a prescription for Wegovy. Ozempic and Wegovy have semaglutide. I got one. I wanted to see how easy it was. Ridiculously easy. Scary easy. Didn't ask me anything. Isn't that crazy? That scares me. That anyone can get access to anything. That's not okay. And that's not providing healthcare to people. In conclusion, and this is that May 11th, the public health emergency ends. Telehealth waivers will end, but statistics show the telehealth industry is valued at, are you ready? $3.5 billion and is expected to grow by 24% between 2023 and 2030. So what does that mean for you and your healthcare? What do you have to look forward to? Telemedicine. Get used to it. I think it's your future. I think it's all of our futures. The data suggests the probability of healthcare providers and future startups to engage in fraudulent activity is high. The Department of Justice will have its hands full monitoring all future internet telemedicine sites. The one thing I didn't mention as well is HIPAA laws. HIPAA is the Health Insurance Portability and Accountability Act. And HIPAA laws, we sign HIPAA laws to make sure that our medical history is confidential. So for example, when you turn 18, ladies, this happened to my daughter, I called in something and her doctor says, I need to talk to your daughter. And I was like, okay. She was 18. I no longer had any right or access to her medical health care I could not make those decisions for her anymore. And she did not have to share her medical history with me. Your medical information by law, protected by HIPAA, cannot go to anyone else but you, not even your parents when you're 18. Did you know that? It switches to you. Okay, here's the good news about that. Let's say you have an employer and you're applying for a job and you've had cancer. And they somehow, through a telehealth site, get access to your information. And they know that you've had cancer before. Can they make a judgmental call and not hire you because of a previous medical condition? They've done this with AIDS patients. You cannot have prejudice or discrimination in the job market based on someone's medical records. That information should be private and confidential because of HIPAA laws. So HIPAA laws protect us. The same thing could happen if you want to go to Harvard. If they find out you have a medical history and they don't think you can finish your degree or become an alumni, they may not grant you admission. And that should never be factored into the equation. So let's say you put your information with a telehealth company and it's fraudulent. Is your medical history secure? You've just put your information out there and they can do whatever they want with it. So they're not interested in protecting your privacy or your confidential medical information. So be careful. Now, your doctor that you have, they understand HIPAA laws. You have to sign them. Your parents have to sign them every time you go to the doctor. You're going to be okay with a telehealth visit with someone you know that is your doctor. I'm talking an unknown person on a website when you're trying to get a drug. Does that make sense? Your information is not private. We all clear about that? All right. Any questions? How'd I do? Was opponent stronger? I felt like it was too. Okay, y'all are the first ones. And I'll pause right there. Do you know what Saturday's prompt is? I'm so excited. Do you want to hear it? Because I just came up with it today. Self-checkout. Isn't that a great topic? Do you like it? I am going to share with you the most disgusting, gross thing you will ever hear. And you are going to look at, ladies, self-checkout in a whole new way after next week, okay?
I'm excited.
I'm like today, I was gasping. I was like, oh. Let me just put it to you this way. When you push those buttons at self-checkout, have your hand sanitizer close by. Okay? It's like going to the bathroom and touching the screen. That's how bad it is. Yeah. Super exciting. Okay, that is the end of opponents. So I am going to, you're welcome. Thank you, ladies.
I'll finish both my essays by the end of the week because I've been behind on school because I went on a trip for tennis.
School comes first.
Yes.
Okay,
Thank
and
you.
I know you will get to it.
Thank you. Have a good day.
Thank you. Okay, I'm gonna wait just a minute to see if anybody comes for proponents, but I'm gonna do these two back to back. Okay. I'm gonna Okay, we'll see if anybody shows up for proponents. Otherwise, I'm gonna record it like this. There's bugs. There's an ant. Yuck. Give me the screen. Okay, if somebody walks in, we'll do it, but I'm gonna go ahead and do it like I did before. I'm gonna start with the video. Here we go. This is proponents of telehealth.
Hi, Alyssa. It's good to see you.
Skip the clinic with virtual visits from CHI Franciscan. Now you can get trusted medical advice and treatment from the comfort of your home. New patients can conveniently access providers, while existing patients can see their regular provider or a provider offering virtual visits.
A virtual visit is a visit where the patient is not physically here with us in the clinic, but we're able to connect and engage with them still through a secure video chat.
All you need for a virtual visit is a smartphone, tablet, or computer with a camera and a microphone. You can get started in 3 easy steps. Step 1. To schedule primary care, women's care, and pediatric appointments, call 844-913-0043. To schedule specialty care appointments, call your specialist directly. When you call, you will receive a meeting ID number. Step 2. If you are using a mobile device, download the free Zoom Cloud Meetings app from the Apple App Store or the Google Play Store. With a computer, you can download the app through the Zoom website. Step 3. When it is time for your appointment, open the Zoom app and select Join a Meeting. Enter the meeting ID, turn on your audio and video, and you're ready to go.
All of our patient access representatives have the ability to walk somebody through the process of getting signed up for the Zoom account to engage with us. And most patients, after they do it, find that it was extremely easy and convenient.
Many aspects of your virtual clinic visit are similar to an in-person visit, including costs and copays. Virtual visits are also encrypted and HIPAA compliant to protect your privacy. For more information about virtual visits from CHI Franciscan, go to chifranciscan.org/virtual clinic.
All right, so I'm gonna stop there. So it looks pretty professional. Okay, let's pause that. Okay. Set up professional audio and audio settings. Well, I can't do that yet. Okay, all right, so here we go. Proponents of telehealth. You both did opponents. So we talked about all the fraud, all the scams on the internet, the false advertising, kind of luring people. I do think people, doctors don't make access to medications easy, do they? So I think as long as there's a way, a shortcut, people are gonna do it. So I think telehealth services, if done right, can be really helpful. So you look at this telehealth visit, like I showed you in the video, it looks like it's on the up and up. It looks like it's a caring physician, a professional who wants to offer quality medical health care, correct? Okay, so we know that telehealth services are not intended. Man, there was an ant and that sucker will not die. Sorry, my bad. It was like crawling across the floor and I just couldn't do it. I had to kill Okay. Gentlemen, I think we all have to get used to telehealth services. They're here to stay. Why? Because of the pandemic. We're gonna talk at next month's prom. I'm ready. I'm doing it on Saturday, 2 days from now. I'm already ready. Like, I'm sick of this prom. But the pandemic accelerated telehealth. Telehealth has been around since 2015, and it was really used more for follow-up, for maybe prescription refills. It was used for specialty care management. For example, if you have diabetes, have you all seen the little circles you wear? And they connect with your phone and they measure your blood sugar and they give you a number. So diabetes is when your body can't produce insulin correctly. So you have too high a sugar or too low a sugar. So a medication for diabetes will keep that blood sugar level constant. And that's what we talked about last week when we talked about Ozempic. Do you remember that? The skinny pen that people are misusing. They're not diagnosing people correctly, and they're letting anyone on the internet, on these telehealth fraudulent sites, to get Ozempic. Well, now Ozempic is cracking down. You can get the prescription, but the pharmacy may not fill it. And even if you get it filled, it's $900. Can the average person afford that? Right? Okay, so what happens to someone who has diabetes is, instead of going to the doctor all the time, if they can monitor your blood sugar through telehealth, it's a lot more convenient for you. Okay, so let's talk about your doctor visit. Okay, you got to go to the doctor, drive to the doctor's office, correct? You sit in the waiting room, correct? Not fun. Then they call you back to the patient room. Do you wait some more? Then you may have a test. You have to wait for the test results. You wait some more. Then you wait to check out. Then you got to drive home. It's a lot. Agreed? Like, how long does an average doctor's appointment take for you?
Over an hour.
Okay. How about you?
Yeah, over an hour.
Are they fun?
No.
Right. Okay. So if it's something like a well check, we know we need a physical every year. That's not something you can do telehealth wise. But if it's a follow-up, that's what telehealth is intended for, right? Let's not make them come to the office, pay a higher copay. Let's do it really quickly in 15 minutes, save everyone some time. So this takes the burden off of you. It takes the burden off the nurses, the people in the waiting room, the people at checkout, and the physician. They are much more good at time management. Does that make sense with telehealth visits? Okay, so proponents. So they're saying after 3 years of COVID-related issues and the public health emergency ending in May, one favorable outcome from the pandemic has been the increase in telehealth services allowed. You understand that telehealth was all because of COVID. It was to contain the spread. Okay, so now the government is talking about, you know how they give you the COVID kits for free from the government? They're going to give you a flu and COVID at the same time. Why? Because if we can keep you out of that doctor's office, exposing everyone in the waiting room, everyone in the patient room, all the doctors and nurses from your infectious disease, and we can do it through a telehealth visit and you've already tested at home, do you see how this makes it so much easier and safer for everybody? Okay, so let's say you have a test, a COVID flu test combination, and you test positive for the flu. Do they want you in the office? No, you're highly contagious. The other thing that's good about that is you've tested positive, you've shown them in a telehealth visit, you know what they can do? They can prescribe for you an antiviral. Have you ever had Tamiflu? Do you know what Tamiflu is?
Isn't it like the what you take for food?
Okay, so there's no cure for the flu. There's no cure for COVID. The flu and COVID are endemic. They will be with us forever. Every year, people die from the flu. That was from the 1918 pandemic. Every year, people still die from the flu. Every day, people are dying from COVID. People will always die from both of them. Some people, it just hits. There's no rhyme or reason. And it's timing in life. It's where you are. If your immune system is compromised, it hits you at the right time and place, you're gone. However, We have antivirals for both the flu, Tamiflu, and COVID, Paxlovid. Do you know what an antiviral does? It reduces the length of time you're sick. And turn your phone off, would you?
Yeah.
Just turn it off. And it lessens your symptoms. If you get a telehealth visit and get an antiviral for COVID or the flu, you're probably not gonna die. You just saved your life. And all it took was a quick 15-minute telehealth visit. Right? You don't have to die from the flu or COVID. There are antivirals to help you recover, right? And you've kept the infectious disease out of the waiting room and away from the physicians and other healthcare providers. So this really was the intention. So this is really cool. Agreed? Let's keep the sick people out of the office. Yes. Okay. Telemedicine became a way to offer quality medical care with the convenience from home on an electronic device. Which means if you live in a rural area, gentlemen, do you have access to good doctors or specialists? Why not?
Because there'll be less hospitals near you.
They can't even get doctors to come out to rural areas. They don't have enough money to pay them. You're not going to get a high quality doctor out there. You're not. And if you need a specialist, you probably don't have enough money to go drive to one. Let's say your specialist is in, I don't know, Alaska, right? Could you and I see a specialist in Alaska through telehealth? Yeah, right. So it really kind of opens up possibilities, doesn't it? Telehealth. And not just in physical health. We had a shortage during the pandemic of mental health counselors. Did y'all know that? Today, mental health counselors are in such high demand, there's not enough of them. You probably can't get an appointment with a mental health counselor because they don't have any openings. So my daughter found this out. My daughter lives in New York and she was looking for a counselor. She was struggling a little bit. And I will tell you, you need to put your physical health and your mental health as a priority. They are both equally important. So she says to me, Mom, I found a great counselor. I'm like, oh, good, great. She said, she's in Miami. I said, wait, your mental health provider is in Miami? She goes, yeah, I love her. So she is in New York, but found a mental health provider in Miami. Is that not cool? Have y'all been to New York? Do you know how hard it is? How much it costs to get to the doctor in New York? It's a cab ride, an Uber ride there and back. That's a good 50, 60 bucks. In addition to your copay, right? So telehealth in really busy cities is like amazing, right? So convenient. Okay, let's be honest. If you had a mild thing like a rash, I have a rash right now for my Apple Watch. Do I need to go to the doctor for that? Or will a telehealth visit be enough? Right? I have a rash. Okay, a telehealth visit. So for common medical conditions, this is fantastic, don't you think? Maybe it would minimize the wait time that you have at the doctor's office, don't you think? Right? I just think it makes it more accessible for us to get access to healthcare. It makes it easier. It's quick, right? At home, you could probably have your telehealth visit in your jammies, right? Not even have to shower, right? Cool. So this is a big deal. So here, let me give you some statistics. I'm going to go to body one. Y'all are with me. Statistics indicate the utilization of telehealth will continue to evolve and play a pivotal role in transforming overall healthcare services offered now in the future. So I'm going to ask you a question, gentlemen. Okay, do you remember online learning? How did it compare to in-person learning?
Not as great.
Okay, on a scale of 0 to 100, like 10%, 20, 50, 60, 90, how would you compare online learning to in-person school? Give me the percentage.
Maybe 70 or
You got
60.
70% out of online school? That's the highest number I've heard all week. What'd you get?
40.
Okay. Okay, so I want you to know why that happened. Okay, teachers didn't know what Zoom was. Teachers had never had to worry about online learning before, had they? Was it all new to them? Brand new. There was a learning curve. They had to figure out how to do it and fast. Agreed? Did online learning get better? Yeah, right. They figured it out, correct? Gentlemen, telehealth's been around since 2015. They didn't have to reinvent anything. They didn't have to learn anything. They already had it in place. They already knew how to do it and how to do it effectively. Isn't that fantastic? It's already been there. So here's what people feel about telehealth, which is online healthcare. Are you with me? Versus in person. Telemedicine respondents, 74% of respondents, that's a pretty high number. That's higher than your 70%. Believe the professionalism of the healthcare provider during a telehealth visit is comparable to an in-person visit. That's higher than your 70%. 74% of people are happy and think their telehealth visit is the same as an in-person visit. Does that number surprise you? It's pretty high. 68% say the quality of service provided is exactly the same. I was pretty amazed by that number. People are happy with telehealth services and somewhat satisfied with the quality offered. I think it's because we recognize it doesn't take the place of an in-person visit. And the reason we're doing a telehealth visit in the first place is to get quick access to care, and it's not that severe or serious. Agreed? So JD Powers did a study and found telehealth utilization has become more than simply a means to avoid contagion of infectious diseases. It is a way for patients to bolster their existing health routines. So as I previously said, it improves patient access, right? You know, if you and I have a doctor here and we need access to a specialist and the specialist is in Seattle, we could have a telehealth conference. We wouldn't have to drive to Seattle, right? So that makes it more convenient. Can it serve more people? Absolutely. Is it more efficient? In some cases, yes. And it does cost less. The copay is less. Especially for people in remote areas. Okay, the CDC has shown an increase in telehealth visits. So what does an increase in telehealth visits tell you? More and more people are using them. They like them, correct? In 2021, 37% reported they use telemedicine. That trend continued in 2022. The American Medical Association reported 4.2 million Medicare patients access care through telehealth. 95% of Medicare beneficiaries were satisfied with the telehealth experience, according to the CDC. Here's another important statistics that I found. Are you ready? Apparently, people no-show in-person doctor visits. Today, 36% of in-person doctor visits are no-showed. What is a no-show?
They don't come.
They don't come at all. They just forget or don't come. That's a pretty high percentage, right? The percentage of people who no-show telehealth is 7%. What does that tell you? They'll show up for a telehealth visit more than they would an in-person visit. Does that surprise you? It's that convenient, isn't it? Because it should tell you that it's really hard sometimes to get to the doctor's office. With reported high levels of satisfaction from healthcare providers, patients, and insurance companies, it would appear telehealth will continue to grow while improving access and effective treatment of physical and mental health conditions. So it's not just physical, it's the mental health too. And both of those components are really, really important in telehealth. Okay, I want to share with you the second thing that I think is amazing. We talked about Ozempic, right? And we talked about how these telehealth services were fraudulent and they would allow anyone to have access to diabetes medication. And it caused a shortage of diabetes medication. Well, that's pretty messed up, right? But here's the good news. Ozempic has this ingredient, semaglutide, which helps people lose weight. The average person loses 14 pounds a month. What do you think that would do for America and our #1 obese nation? Could we help a lot of people? So in comes the diet industry. Weight Watchers is #1 in the weight loss industry. And by the way, the weight loss industry is $1 billion industry. People are excessive with their eating in America and they want a quick, easy way to lose weight. So Weight Watchers, what they do is they have food training. Like they teach you how to eat healthy and how to eat, what to eat in better portions. And they teach you that exercise is important. If you want to lose weight, you also have to burn calories, right? They just bought a telehealth company called Sequence, I believe. Let me get my number correct here for, I'm on body paragraph number 2, for $106 million. You want to know what they're going to do? They're going to help their weight loss patients. They're going to give them the food training and the exercise training, and they're going to prescribe semaglutide, Ozempic, or Wegovy, but they're going to monitor them. They're going to make sure their side effects aren't too extreme, and they're going to monitor their progress. Is this how it should be done? Yes. I was so excited. And then when Weight Watchers did it, guess what happened? Noom, Nutrisystem, SlimFast, all of these other weight loss centers did the same thing. And I thought, wonderful. No one wants to be fat, correct? If we can help people, we can reduce diabetes, we can reduce hypertension, we can reduce heart attacks and strokes, because all of that is related to obesity. We have a goldmine drug here, gentlemen, but it shouldn't be just given to anybody without being monitored. And that's what the opponent side was. Now we have people giving prescriptions and it being monitored the right way. And it's a whole package of information. It's not just teaching them, here's a quick drug to lose weight, because here's what happens when you stop taking Ozempic. What do you think happens? You gain all the weight back, right? Because you can't be on it indefinitely, and you can't afford $900 a month indefinitely either, can you? So what they're doing is showing you how to change your life and your habits, but giving you a little help to get there. I love this, gentlemen. Isn't this exciting? To do it the right way. Telehealth has been around, like I told you, since 2015 in specialty care management. And this is #2. It can be used in cardiology, endocrinology, hepatology, nephrology, neurology, pediatrics, surgical perioperative care management, pretty much anything. So what it was intended for was follow-up visits and monitoring. So I talked to you about the diabetes patient. That requires a telehealth visit. I mean, if you're a diabetes patient, you know you have diabetes. You're monitoring your blood sugar every day. You can send that information to your doctor. A telehealth visit is all you need. You don't have to keep going to the doctor. Are we all clear on that? Right? The same thing is true for cardiac patients. Tracking symptoms will optimize care. So according to the Journal of the American College of Cardiology, they analyzed 252 clinical encounters with heart failure patients, and 107 of those received virtual care intervention, included a doctor visit and an online pharmacy contact, and those patients who received telehealth were more likely to initiate guideline-directed medication therapy or get appropriate dosing. So that's really good news. Ankit Bhatt, MD, cardiologist at Kaiser Permanente, was pleased by these results. To see a virtual care team could help improve guideline concordant care across 3 diverse system hospitals and do so in a manner that was safe and did not prolong hospitalization was an encouraging finding. So, telehealth services, gentlemen, will continue to reshape the overall healthcare experiencing, offering several unique specialized services, which will give greater access to improve patient care. Okay, so let me end with this. This is the future of medicine. We opened Pandora's box. So unlike online school just kind of went by the wayside, right? Telehealth will be around. Online healthcare will never go away. It will increase exponentially. Why? It's the new frontier. It is a way that physicians and providers can give access to people, treatable common conditions, but also specialized care and management of chronic conditions to anyone who has technology access. And that's pretty cool too, agreed? Okay, so the COVID pandemic and special government waivers will end soon. Well, the emergency will end May 11th. Unfortunately, telehealth waivers will continue through December 2024. I believe, in my opinion, and what opponents we talked about, this pandemic opened up Pandora's box. And we have a lot of people providing telehealth in a way that's not appropriate, that is illegal, that is criminal. But that was never the intention of telehealth, which started long before the pandemic. So the main goal, if your provider is doing what they should be doing, is to offer the highest quality care possible. Why? Because when a physician becomes a doctor, they take the Hippocratic Oath. Do you know what the Hippocratic Oath says? You swear, you take an oath to do no harm. If you're prescribing controlled substances and medication without follow-up care, that is doing harm. Are we all clear on that? So anyone who is credible, who is an ethical physician or healthcare provider, would never do that. So telehealth was never intended this was never intended to happen. It happened because of the pandemic, that these fraudulent companies could prescribe medications. And unfortunately, people are loving it. They love access to medications that they can't get through their doctor. But that doesn't make it right, does it? Right? So this is pretty exciting. That if you have a credible and ethical physician, which you do, right? Because your parents make sure that you have quality health care. But someday, gentlemen, you'll be 18 and you'll be choosing your own healthcare provider, right? And you'll know what to look for. Which side did you agree with?
Like a mix.
They're both right. Any question? Okay, do you want to know Saturday's topic? All right, I'm going to end. All right, do you want to know Saturday's topic?